Nothing like that.
Yeah, good afternoon. A very hearty welcome to this awareness program on the prevalence and prevention of menstrual cycle disorders in women. This event is designed to educate, empower, and promote menstrual health and well-being among women of all ages. After completing this program, participants able to learn common menstrual cycle disorders, understand the physiological and psychological abnormalities, identify symptoms, and the importance of early detection, expert insights on prevention of and life cycle modifications, apply stress management and self-care techniques. It is my pleasure to invite our speaker, Dr. J. Karna Kumari Garu, Assistant Professor, Gupta Armed Force Medical College, Rohini. Please come on the dais and occupy the chair. Please, madam. Thank you, madam, for answering your invitation. Dr. J. Karna Kumari Garu awarded gold medal in MSc Zoology. Madam also completed PhD in toxicology from Usmania University and published research papers in national and international journals. I thank each and everyone for attending this program. I will now hand over the session to our speaker to deliver a lecture. Thank you, madam.
Good afternoon. Good afternoon. Thank you, Kishore sir, for giving me this opportunity. Also, I thank Ambedkar University for giving me an opportunity to present myself here. I'm very much concerned about women because as I'm a working woman and also as I'm a teacher, I teach in Gurukula Degree College, Armed Forces. Presently, I'm working at Bonnegiri Degree College. I observe the students suffering with many menstrual disorders. They even don't want to attend the class when they are in periods. So I got a concern, not only them, as women, we also suffer the same, we also feel the same. So I got an idea of I want to know more about these things and I want to bring, at least if not, I may not solve the problems, but let us try to prevent it. I thought and I started working on it, and as a result of that, I came with some data to present in front of you. That is prevalence and prevention of menstrual cycle disorders in women. See, prevalence, I hope you know the meaning of prevalence. Prevalence is nothing but it is the occurrence or commonness or frequency of anything which happens. Presently, as we are concentrating on menstrual cycle, it is related to menstrual cycle disorders. And prevention is nothing but stopping or taking some precautions and trying to stop it. Okay, that's called as prevention. So all of us know that prevention is better than cure. So let us try to bear with me, listen to me, and also observe whatever I am showing you the slides, and try to make a conclusion what is happening actually during the periods and what we should do to avoid painful menstrual cycle. That means it is must and should that as we have means in our lifetime as a degree, suppose I think you are a degree or a MSc students. So as the students, you need to go through the exam. If no exam, no certificate, isn't it? No notes or no award. So surely we need to go, but we can make it easy. Okay. So like that, let us see what I'm going to. Prevalence and prevention of menstrual cycle disorders in women. Why I have chosen this means, as I have told you, I have observed many the thing periods are literally affecting the students, not only students, working women, and also women. So to help the women, I want to search for a solution. So to prevent the menstrual cycle disorders, what all things we need to do, I am going to tell because we need as women need to lead successful stress-free life. We need all these things. Okay. Then how it is possible means through managing our lifestyle, including good diet, and also trying to live stress-free life by managing ourselves. So before going into the topic, we all know that we were all controlled by something. Basically, as we are science students, we know that in our body there are many chemical substances which are being released and which are controlling different organs in our body, like enzymes, hormones. Okay, all these things will be there. They will be released into the circulatory system, and they will be circulating in the blood, and they come and act upon the target organ, and they give their function. Among them, one of the thing which is very much important regarding our reproduction is hormones. Hormones, there are a number of hormones and many glands, endocrine glands are there, but as we are studying or as we are trying to know about reproductive system, particularly females, and also we will go through a little bit about males also. So we are concentrating on the hormones which are related to reproduction. The hormones which are related to reproduction are called as gonadotrophic hormones. Especially, we know they are FSH and LH. FSH is nothing but follicle stimulating hormone, and LH is luteinizing hormone. Okay, and also we have other hormones which will be stimulated by these hormones, and the ovaries and testes will be stimulated by FSH and LH, and they release other hormones like progesterone and estrogens. See, why these LH and FSH are needed means they are must and should for the development of our gonads. Gonads are nothing but ovary and testes. Okay, if they are not mature, they don't produce their gametes. Without gametes, no reproduction. Okay, so if reproduction need to occur, why we need reproduction means to maintain the generations and also to maintain the ecological balance, we need reproduction. Okay, if there is no reproduction, there is no species, isn't it? So obviously, reproduction is must and should. It is a nature law. So to satisfy that, we need gametes. Gametes come from gonads. So gonads are mature. They are placed by God in our body by our birth, but they need to be matured. So for the maturation, the required hormones FSH and LH. Okay, so no FSH LH means no reproduction. So it results in different abnormalities. Different abnormalities like menstrual related problems will be there, sex related malfunction will be there, all those things will be there. Coming to the overview of menstrual cycle, what all things will happen to be making it generalized. See, almost all of us know what is menstrual cycle. When does it occur and when does it complete? See, it starts, the maturation or menstruation starts at puberty. Puberty in sense, Telugulo yavanam antaru. Yavanam vayasuni puberty antaru. Okay? It starts then at puberty and ends in menopause stage. So puberty in the sense between 8 to 15 years of age. 8 to 15 years of age, on an average 12 years, and ceasing or stoppage of menstruation occurs at the age between 45 to 50. Okay, first menstruation is called as menarche, and ceasing or stoppage of this menstruation is called as menopause. We all know that. See, in olden days, when I was small, very rarely I used to listen or I used to hear about menstrual cycle and all those things. But nowadays, as women are facing many problems regarding this, I'm listening to this word very frequently. Another thing is that maturation in those days, it is very much means after 13 or 14 years, girls used to undergo maturation. But now we are listening 9-year-old girls are also undergoing maturation in very small age. And also even as a working woman, I can affirm that even menopause is also being, the duration is reduced. Now, no need to go up to 45 years. It is happening even in 30s. Okay, these are all is only due to stress and also the food we consume, the unhealthy food habits, and also the pollution what we are making. It's not by itself, it is made by us. Okay, so we need to take control of all those things. Normal menstrual cycle, in the sense, it occurs, we all know, the cycle occurs for 28 days, isn't it? But in some, it may occur before, means for every 20 days, and in some, it may take more than 20 days. So on an average, it occurs between 20 to 40 days. Okay, and average duration of the menstrual cycle, in that period of menses is between 3 to 8 days. 3 to 8 days. If it is more than 8 days, that means something is wrong. So we need to take care of that. Okay, and the other thing is that normal estimated blood loss is on an average 30 to 60 ml. If it is more, if bleeding is more, then it may result up to 80 ml. If it is more than that, that means we are becoming anemic. We need to consult a doctor. And another thing is that ovulation. Ovulation is nothing but the rupture of the Graafian follicle and release of the egg is called as ovulation. Ovulation is must and should, which helps in further process of reproduction. So ovulation occurs at in this 28 days of cycle. It occurs on 14th day. Okay, and on an average 12 to 14 days. We can take as 12 to 16 days. Okay, so when a couple is newly married, then if they need children, the doctor will suggest them to be together between 12 to 16 days of the women's menstrual cycle, so that they can get conceived. Okay, so that is very important. Now, we all know, I think you all have come through this structure of reproductive system. These are the main 4 parts of our reproductive system: the vagina, uterus, fallopian tubes, and ovaries. Coming to the menstrual cycle, it occurs in 4 phases. First one is menstruation, second one is follicular phase, third one is ovulation, and the fourth one is luteal phase. In the menstruation, as we are discussing, menstruation is nothing but a bleeding phase. Okay, it is when the internal lining of the endometrium. Endometrium is nothing but the lining of uterus is called as endometrium. Okay, it is the time when the internal lining of the uterus is removed or falls off or sheds off after the completion of the 28th cycle. Okay, so that occurs it occurs for a period of 3 to 7 days. Another thing is, second stage is the follicular phase. Actually, this is the start of the cycle. Okay, so as I have told you, the gonads are placed within us when we are born. Okay, when we are born, that means when we are told is then only God has kept that reproductive system in us. We have ovaries than itself. Okay, మనం పుట్టినప్పుడే మనలో దేవుడు ovaries అనేవి పెట్టడం జరిగింది. So they start there, but they will get mature only after the birth. We need to know this. Okay, so in the follicular phase, what happens means here the FSH and LH will be released from the pituitary gland, which is present near the brain. Okay, that pituitary gland produces FSH, that is follicle stimulating hormone. It travels to the blood and reaches the ovary. Okay, ovary consists of number of, see you can find there. See you can find here. Like it was. Okay. See, you can find there developing primary follicle. Can you see last ones? Can you see? See the at the starting of the diagram, you can find the like opening like structure there. The follicle, starting follicle is there. They will be very smaller in size. Okay, and as the FSH will be releasing from pituitary gland, they come and stimulate the development of the follicles. Okay, slowly they develop into secondary oocytes like next follicular cells will be forming, and later on slowly the follicles grow into Graafian follicles. Graafian follicles are nothing but the matured form of follicles are called as Graafian follicles. In this Graafian follicle stage, they rupture in the presence of LH and they release ovum. Okay, the ovum, whichever is released, will come out from the ovary and slowly it reaches the. See, slowly here you can find. Slowly it reaches the fallopian tubes. Then at the same time, if the fertilization occurs, okay, that means if the sperms come in contact with the ovum, then there occurs the fertilization and further process goes on. If no fertilization, if no sperm, then that ovum will be reabsorbed into the body of the women within 2 to 24 hours of time. Okay. If in case fertilization occurs, generally as soon as the Graafian follicle ruptures and releases the ovum, that is called as ovulation. As soon as the ovulation occurs, the remnants of the Graafian follicle will be converting into corpus luteum. Okay, corpus luteum, it produces a hormone called as progesterone. This progesterone, it does a very great function, that is, it makes the home of the upcoming embryo, that is uterus. It maintains the uterus. It thickens the wall of the uterus, that is endometrium. Thickens the wall of the endometrium. Why? Because if you see the structure of the reproductive system of a female, then occurs fallopian tubes and also uterus. Uterus is elastic in nature, but fallopian tubes are not elastic in nature. Okay, so as a uterus is elastic in nature, it will be thinner in means the thickness will be less, and if the embryo comes and gets implanted there, then it may not bear. So, in order to make it strong, slowly the progesterone, what is its function means, it slowly makes it thickens the uterus wall to make it available or to make it perfect for receiving the upcoming embryo. Okay, that is what happens usually if whether the fertilization occur or not, this step will happen. At the same time, if suppose fertilization occurs, then this corpus luteum slowly degrades, and that after fertilization embryo will form. Then now this embryo which has formed will start producing progesterone, and this progesterone goes on maintaining the pregnancy. Okay, if no embryo, that means no progesterone. Okay, now the culprit start here. The problem start here. No progesterone, there will be a sudden fall of progesterone levels and also estrogen levels, or the hormonal level imbalance starts. Now we will experience. So these are the stages. I have concluded everything in my speech. Okay. So as soon as the progesterone levels fall, then starts the problems of women. They are called as premenstrual syndrome. That means before the onset of the menstrual cycle or periods only, we will be feeling uneasiness, dizziness, mood swings, everything will be seen. So we can classify them into different kinds of changes. They are physical changes, psychological changes, and emotional changes. Under physical changes, as women, we can sense the tenderness of the breast, swelling, diarrhea. Some face the constipation even, and bloating and all the gas. These are the symptoms of. So either it might be before the onset or after the onset, even post menstrual cycle also we will feel we will sense these problems. Okay, these are common things, but because of the conditions we are facing, situation we are in, we might be feeling as if it is something which is not right. Okay, so cramps are very common, and headache, backaches, fluid retention, tiredness, dizziness, all these are the problems which occur during our. The other thing is that I need to tell you one thing. Why we experience the cramps? Because as soon as the progesterone level falls, then what happens means I have told you that progesterone is the main hormone which is maintaining the endometrium, which thickens the endometrium and maintains the pregnancy. Okay, as soon as the progesterone level falls, then slowly the wall which is thickened, the endometrium which is thickened, it has to be set right and it has to be made normal. If it is not made normal, it results in cancer. So whatever thickness has been attained by the uterus, it has to be removed. So what happens as soon as the progesterone levels have fallen down, slowly the wall of the uterus will be teared off, and it will be coming out as menstrual bleeding. Okay, so let us suppose assume this is the endometrium. Okay, this is the uterus. So this is the wall. What happens? It is having two layers. This is the outer one and this is inner one. So the inner layer will be teared off. What happens? There will be some blood vessels here, isn't it? Obviously, if something is live means there will be supply of blood. If no blood, no life. Blood itself is life. Okay, blood itself is a life. If no blood, no life because no oxygen. So no nutrients, nothing will be there. So surely if something has to be live, there should be blood. What happens as soon as the progesterone has been fallen down, means its level has been come down, then the inner lining of the uterus will be teared off. Okay, అది ఎట్లా అంటే కట్ అవుతుంది. ఇప్పుడు కట్ అయింది అనుకోండి స్కిన్ కట్ అయితే ఉంది. ఇప్పుడు సపోజ్ కట్ చేసి స్కిన్ తీసిన లోపల బ్లడ్ ఉంటుందా? ఉంటుంది కదా. సో ఇన్ ద సేమ్ వే దాట్ బ్లడ్ విల్ బి బ్లీడింగ్. సో యాజ్ కట్ చేస్తుంటే పెయిన్ వస్తుందా? The same thing happens in every woman's uterus. Okay, that is why we feel very painful. Stomach pain will be there, cramps will be there. Okay, the blood whichever is being lost is pure blood. Our people, our elders will sell another waste blood material. One way, but it is the good blood. It's a purified blood. It's the actual blood which has to be there. Without, if it is not pure, see the same blood the embryo is being forming. If it is impure blood, it doesn't give life. Okay, so the blood whichever is lost during the menstrual cycle is pure blood. So only as soon as the menstrual cycle completes, we become weak, tired. We need to consume more and we need to maintain ourselves. Okay. So these are the physical changes and psychological changes. Obviously, we will be very aggressive behavior, irritating troubles will be there in sleeping. We don't feel comfortable in sleeping, and also we will be facing the problems of concentration. We don't concentrate. There will be problem in remembering, stress, anxiety, mood swings will be there, depression will be there. All these things will be there psychologically, and also we feel very tensed and anxiety will be there. Especially working women, they face a lot because they need to maintain their self, they need to maintain the family, they need to maintain the company or institute. So all these things together makes more pressure on a working woman. So here one thing I would like to point out that you might be getting down, but I got down. That why we are suffering with stomachache when we are in periods. So the answer is due to the sudden fall of progesterone hormone. there occurs the tearing or the shedding of the uterine wall, which results in the rupturing of blood vessels, which is very much painful. So only we face or we have the feeling of stomach pain. So this is the picture showing different symptoms of premenstrual syndrome, anxiety and irritability feeling. Some people will be having more food, some will not at all eat. Okay, everyone will be suffering with headache and back pain. Almost all will be suffering with back pain and headache. Okay. Coming to the common menstrual problems. That is, up till now I have explained how the process occurs and what are the common symptoms. And there are different types of menstrual cycle disorders. There are cramps will be there, as I have explained you, painful menstrual cycle. Next, endometrial shedding of endometrial results in cramps. Dysmenorrhea. Dysmenorrhea is nothing but painful periods. Again, it is of two types: primary dysmenorrhea and secondary dysmenorrhea. This painful periods only is defined as dysmenorrhea. Okay, this occurs the primary dysmenorrhea, as I have explained you. It is due to the contraction of the uterine walls and the shedding of the uterine wall after the fall down of the progesterone. Okay, secondary dysmenorrhea, it is a resultant of some other physical problems. It might be due to endometriosis, or it might be due to uterine fibroids, it might be due to ovarian cysts. You might be hearing about PCOD. PCOD, nowadays it is very much frequently heard word, PCOD, that's polycystic ovarian syndrome. Okay, PCOD is disorder, polycystic ovarian disorder or disease, and PCOS is polycystic ovarian syndrome. Syndrome is a group of diseases. It includes many diseases. Disorder is a single thing. Okay, so if other than in common, everyone will be suffering with dysmenorrhea, cramps, and primary dysmenorrhea. But in rare cases, very few women will be suffering with secondary dysmenorrhea. See, you might be getting down. What is endometriosis? Endometriosis is a condition where the tissue, same like that of uterine wall, will be present outside the uterus. Okay? What happens in general during the periods, the uterine wall will be shedding off after the fall of the progesterone. So, if the same kind of tissue is present in our body in some other region, let us assume what happens, that also will be shedding out. Okay? So, in the same way, in the case of endometriosis, what happens means, other than the uterus, some areas of the female reproductive system will be containing this tissue, uterine lining wall tissue will be there. So that endometrial tissue will be there. So as the periods are happening, at the same time as the menstrual bleeding is happening, other regions also bleed. So it leads to a very painful situation. It will be horrible. The pain will be horrible. And the reasons we don't know why it is happening. Still, studies are going on, but it is very much painful thing. And uterine fibroids means like tumors. Some tumors will be forming in the uterus. It might be due to infection or some other abnormal solutions. And ovarian cysts are also cyst in the sense it is nothing but a satellite structure which is filled with some fluid or some other liquid material. Okay, so if cysts are generally cysts will be there. I hope you know or don't know, I don't know. But in general, women will be before the menstrual cycle, means or before the onset of the menstrual cycle, and also in some after the onset of post menstrual cycle, white discharge will be there. Okay, that is nothing but it is formed only due to the breakage of some ovarian cysts. But that is a very common thing. Problem is when the discharge is very smelly, very sticky, very itchy. If it is like that, then it is some problem. Until unless if it is normal, it is of no issue. Okay. So So ovarian cysts are common, but if they are means more than the limited means ఉండవలసిన దానికంటే ఎక్కువ ఉంటే then it's a problem. If it's unlimited, it is a problem. Okay, so the reasons might divide. What are the reasons means what might be the reason for menstrual cycle disorders means so in some it might be eating disorders. Eating disorders means suppose if we are eating in normal days means when we are not in periods in normal days if you are consuming a very spicy food we are drinking very less water. Okay, and we prefer fried food. We go for carbohydrates, burgers, pizzas, unhealthy foods, junk foods. Okay, we don't prefer fruits and vegetables or fiber food. We drink very little water. Okay, then all these things are going to be a reason for a painful menstrual cycle. Okay, so managing this means in normal days, if you are having good amounts of fiber, good amounts of water, then it helps to some extent to reduce the menstrual disorder or menstrual pain. Okay, you might be getting out. What is the link between this and that? The link is that menstrual bleeding means we will be losing blood. Blood is a composition of what? It's composed of almost 90% of water is there in blood. Okay, so if you don't drink water, then from where the blood is going to come during the bleeding. So it results in painful, it extracts. So our system, as it is must and should, then బలవంతంగా వేరే ఆర్గన్స్ నుంచి లాక్కూడదు ఏదైనా కానీ కాబట్టి ఇఫ్ వి గివ్ మనం బలవంతంగా లాక్కకుండా ఇచ్చేసాం అనుకోండి ఈజీ అయిపోతుంది కదా సో దట్ వాట్ హ్యాపెన్స్ సో ఇఫ్ వి డ్రింక్ మోర్ వాటర్ దెన్ దెర్ ఇస్ నో కంపల్షన్ ఉండదు ఆటోమేటిక్ గా జరుగుతుంది కాబట్టి మనకి పెయిన్ అనిపించదు ఓకే అండ్ అదర్ థింగ్ ఇస్ దట్ youngsters will be facing more painful thing. Initially, it happens like that. Later on, as the age passes on, the pain will be reduced. Okay, thyroid disorders, it is a hormonal imbalance, a hormonal problem, and as I have explained, you polycystic ovarian syndrome might be a reason, and a hormonal imbalance, psychological pressure, insomnia. Insomnia in the sense, see, if we are reading, if we are spending time for without sleeping, if you are spending time for doing good things, it's okay. But still, we need to manage at least 6 to 8 hours sleep is must and should. It is must and should. If we are not going to have that much, at least 6 to 8 hours of sleep, then it is going to disturb us. Okay. So in general, what happens? Our body will be in the working condition whole day. If we don't give rest, then organs they will not clean up or they will not get detoxified. But in general, what happens means the organs will be detoxified when we are sleeping. We will take rest, but they will do work. Okay, they will clean themselves and they keep everything settled for the next day. But we are not giving that time. So what happens? It results in some other problems, health issues, not only hormonal imbalance. Some other health issues also will brain related, our heart related, circulation related, cardiac problems will arise. So we need to at least provide 6 to 8 hours of sleep instead of browsing, going on seeing the shorts, if not YouTube videos, if not Pushpa movie, whatever it might be. Okay, instead of that. Better if we sleep, it helps us. Surely our lifespan will increase if we have more sleep. Okay. So insomnia is nothing but sleeplessness and premature ovarian failure. Some medicines means specialized medicines will be there. Epilepsy, that means paralysis, alarm medicines that will be affecting obesity, irregular blood sugar levels, diabetes, all these things will be affecting the menstrual cycle. Excessive bleeding also. When do excessive bleeding occur means almost all the same reasons are there. Here you can find two different words. Ectopic pregnancy is there. Endometriosis I have already explained you. I hope many of you might be listening to this word ectopic pregnancy? Do you ever listen to that word ectopic pregnancy? Okay, so it is nothing but it's a condition. It's very bad thing. It's a condition of abortion. Okay, so when does ectopic pregnancy occur? Why the baby will be aborted means because as I have told you, after ovulation, the ovum slowly moves from there and it travels through the fallopian tube. Okay, if the sperm reaches and if both come together, then fertilization takes place and zygote will form. Actually, in general, if it is a healthy thing, then that zygote will slowly travel and reaches the uterus. In the uterus, it needs to get implanted. Okay. For that only, our progesterone will be making, setting ready everything that the zygote will come and reside here. For that reason, as soon as the ovulation occurs, corpus luteum secretes progesterone. This progesterone makes a uterine get ready to welcome this zygote. Okay. But if the zygote is slow and if there is some problem, then what happens? That zygote will get implanted there itself in the fallopian tube. Only the elasticity will be present in the uterine wall. There will be no elasticity in fallopian tube. So as the days pass, this fallopian, the zygote which got implanted in the fallopian tube, to some extent, mostly maximum 5 months. The zygote will slowly undergo reaches and it reaches a maximum size to occupy the fallopian tube. As soon as it occupies, as there is no elasticity in the fallopian tube, that embryo or that zygote will die. Okay, so this is a condition. It's nothing but abortion. Okay, that type of pregnancy which occurs in fallopian tube is called as ectopic pregnancy. Okay. So these are the here you can find in the picture endometriosis. See, they are uterine fibroids. They went to see a doctor. Okay. In normal, we have discussed normal conditions. See, regarding the puberty, when we need to consult a doctor. If the menstrual cycle begins before the age of 8, okay, and the girls still have not started even at the age of 15, if the girls have not yet reached the menarche, and if the cycle, whatever has started, if it is not continuous, means up to for 3 years it might be irregular, but after 3 years it should get set right and regularly menstrual cycle should happen. If it is not occurring, then if other thing is that now when the cycle, if the cycle doesn't start within 3 years of breast development, okay, breast development jargon tarvata kuda, if the menstrual cycle doesn't start, that means there is something wrong, that hormones are not producing properly, so we need to consult a doctor and go for hormonal therapy. Okay, and next when we need to, in the case of adults, when we need to consult a doctor. If the large and abnormal clots are discharged during the bleeding, and if menstruation continues for over 8 days, 8 days, if it is more than 8 days, nowadays I am listening with my students, more than there are periods are continuing for them for 15 days or so, and if it is happening so, another thing is that if the during the periods, if we are using only small pads and if the bleeding is very less, it's okay, no problem, but still there is something wrong. But if we are using extra large pads and if we at least if up to 4 pads is okay, it's normal. If we are using more than 4 extra large pads, okay, which are filled completely, then it's an indication that there is something wrong. We need to consult a doctor. If in case if we are not, if with this shyness or some other thing, we don't want to bother our parents, or we don't want to go to hospital. I feel shy in sharing these things to my HS. Then it results in coma. Okay, why? Because our blood levels will fall down. It may reach to 2 or 3. Then hemoglobin levels will fall down. Obviously, if no blood, what happens? No blood, no life. No blood, no oxygen. No oxygen, blood will not means through blood only oxygen will be carried to each and every cell. For cell respiration, oxygen is required. If no oxygen, no cell respiration, no cell respiration, no ATP, no functioning of the cells. If cells function only, then only the organs will function. If organs function, then only our body will function. So overall, everything is based on blood. If no blood, no life. Okay. So that's what will happen if we neglect our periods. If there is heavy bleeding and even then we are neglecting ourselves, just going on buying some pads, replacing them, going on, continuing like that, that means we are becoming enemy, we are becoming weak, we are losing ourselves, someday we will fall down and we may enter the coma. So, my sincere request is that please don't neglect your periods. If the periods are more than 8 days and if it is excess bleeding, so please consult a doctor, take proper medication, try to take some precautions and prevent it. Okay? And coming to the next level, if in general bleeding should occur during the periods time only, means that what we are telling menstruation. If it occurs other than periods time, then you need to consult a doctor. Because in general, normal people, in normal times, bleeding will not occur. If it is occurring, that means there is something wrong. Sometimes it may even lead to cancer. So we need to be very cautious regarding that. Okay. This is how the cysts will be present in the ovary. In general, only ovum will be there, follicles will be there. If the ovary is filled with cysts, that is the dark colored, maroon colored spots are cysts. There are diagnostics tests are there, physical examination, examination, blood tests will be there, ultrasound, all these are for PCOD. See, the normal ovaries on the normal ovary, there will be very less dark structures are there. There you can see many polycysts are there, cysts are there. Poly means many. The symptoms, how can we recognize that we are suffering with PCOD or some problem like this? See, extra hairs will be growing, means unwanted hairs will be growing, and male in general in PCOD conditions, androgens will be releasing in more quantity. Normally, we might be getting out whether there will be male hormones, that means androgens, they are nothing but testosterone present in women or not. Okay, for sure they will be there in women also, and in the same way, estrogens and progesterone will also be there in males, but they are in negligible quantities. Okay, but they are in negligible quantities, so they don't matter. They are not significant. But in these conditions, the male hormones will be increasing in significant levels. Then it results in male characters. Little male characters will be developing. Okay, so acne will be there, extra unwanted hair will be growing, hair loss will be there, excessive bleeding, very painful periods will be there. Okay, and fatigue. Always they look fatigue, means they will be very tired. Okay, restless, and they will be going on gaining weight. They become obese. All these are the symptoms of PCOD. But again, it's not okay. Irregular menses, heavy menstrual bleeding, acne, pimples, okay? Obesity, weight gain, hair loss, infertility. The people who are suffering with PCOD or PCOS, there will be very less chances of fertilization, or they suffer with the problem of infertility. the metabolic syndrome, all these things will be there, or they will become obese, insulin resistance will be developing, hypertension will be developing, high levels of triglycerides will be there, more levels of LDL will be there, all these together are called as metabolic syndrome. They will be suffering with the sleep apnea. They suffer with respiratory problems. As they become obese, the respiratory tract will be stressed, and the width of the tract will be reduced, and it results in respiratory problems. Depression. See, the depression is very common, not only in PCOS people, in normal women also, we will be going through depression. Okay, so this is a condition where the family members has to support the women. Okay, as especially in the case of working women, they need to maintain their means not only in the working women, even if the woman is a home minister, then also special care has to be taken by the family members, as they are also taking part of your work. Okay, so I request the family, whoever might be the family members, might be brother, sisters, father, mother, husband, whoever it might be, they also need to take part, and they need to help us in our works. Then only we don't get more depressed, or we don't feel more tense or more burdened. Okay, if someone is not helping us, if someone is not showing concern, then surely it leads to depression, and it may lead to some other problems. Okay, so their help is needed. As I have told you, if we find any symptoms of, as I have mentioned earlier, if we find any symptoms of PCOS, then we need to consult a doctor. Then how can we manage this? By maintaining our health, by maintaining healthy weight, okay, regular exercise, yoga, quitting smoke. We don't smoke, but some people do smoke. So quitting smoking, next alcohol, taking of alcohol, all these things has to be quit, and we need to go for yoga. Some yoga asanas which help in maintaining, means preventing the PCOS. Okay. And coming to the diet, I'm very much concerned about diet. See, after reading lots of literature and doing some survey, I have made this. See, diet, we need to include rainbow colored fruits and vegetables. Fruits and vegetables. So we should not prefer only some vegetables, but we need to include all kinds of vegetables, even bitter gourd. And also we need to include all kinds of fruits, whether they are sour, bitter, or sweet, whatever it might be, irrespective of the taste, but they are the reserves of vitamins and minerals and healthy nutrients which are very much essential for us. So always we need to welcome our fruits and vegetables. Okay, fruits, regarding the fruits, especially for the women menstrual health, we need to have papaya, pineapple, aloe vera, avocado. All these things, why I have mentioned this means they have natural estrogens included in them. They help in improving improving estrogen levels in our body, and also they help to regularize our periods, menstrual cycle. Okay, and other things, we need to replace the white flour, rice flour, pasta, cereals, especially sugar. We should not have sugar. Sugar is cancer causative. We should avoid it. Okay, we need to include whole grains like wheat, oats, next peona. All these things help, brown rice. All these things are full of with abundant fibers. They also contain proteins. They help in maintaining or recovering our reproductive system collapse. So we need to include this instead of pasta, pizza, burger, okay, sandwich. Instead of those things, we need to include this. Include legumes like beans, lentils, peanuts, and all those things. Instead of snacking on chips, kurkure, I eat kurkure. Eating what all things will be there in samosa, all those things. Instead of snacking on that, it will be helpful if we snack on dry fruits. Okay, and also sweet corn. Sweet corn, I came through means one of my students was suffering with PCOD problem. In the previous months, she is not, but after 1 or 2 months, she came with the scanning, which in which the ovary is with full of cysts. Then she has, based on the doctor's suggestion, she has modified her diet. And without any surgery, she got recovered and her ovaries became normal. Okay. In her diet, I just cross-examined her. Means I have asked her, what have you consumed? She told she used to have sweet corn, not boiled, raw one sweet corn, and she has also included this wheat flour chapati. And she has included more amount of vegetables and fruits in her diet. Regularly, she used to consume fruits and vegetables. Okay, that husband, she actually initially doctor has suggested if she don't recover, then she need to go for surgery. But with the diet only, she got recovered. She even has included dates. Okay, we need to replace the oil. It means if not always, at least frequently we need to use olive oil, and we need to have spices, not spicy spices, healthy spices we need to include. Okay, carom seeds, actually, oma, we call in Telugu oma and fennel, that is soap, cinnamon, ginger, all these help in our menstrual health. And also, we need to drink at least 8 to 10 glasses of water daily. Minimum, that is minimum of 3 liters of water is compulsory. It is must and should. As if we get any problem or any health problem, sincerely we will take, we will buy the medicines. Sincerely means time to time we will take the medicines. In the same way, we need to consume water, which is a natural medicine, which is healthy, which gives us health. So it is very much important. So prevention is better than cure. We need to include all these things. Quit smoking, alcohol. We need to add good amounts of vegetables, fruits, maintain healthy weight, adequate sleep, eat hot foods, stress management. Okay, positive thinking. All these things to be included. Finally, I can't. The Kishota for giving me this opportunity, and also I thank my principal madam, Dr. G. Nirupa madam, and our secretary ma'am, JS ma'am, and Anjay ma'am for giving me permission and for giving me a chance to present myself here. So this is all about our menstrual cycle and menstrual cycle disorders. So everything is in our hands. Everything is in our hands. If we think positively, the things will be positive. If we think negatively, the things will be negative. Okay, it is practical experience. So let us be positive. So everything is a part of our life. We should enjoy it. Instead of pointing and always complaining, let us enjoy. Let us try to manage. Let us try to prevent by taking some cautions, by making ourselves available to good things. Okay, thank you. Thank you very much.
If you have many doubts, you can discuss with our people. We can answer. This is okay, ask questions to the chat box. You man chat box.
Any questions, ma'am? No questions, no comments.
Yes, you can ask.
Yes, you can ask. You are welcome.
Yeah, please start with us.
తెలుగులో అయినా పర్వాలేదమ్మా అడగండి.
తెలుగులో కూడా అడగవచ్చండి. మీకు ఏ సందేహాలు ఉన్నా మీరు ఏమి చేసుకోవచ్చు. జూమ్ యాప్ అటెండ్ అయ్యేవారు కూడా జూమ్ లో చాట్ బాక్స్ ద్వారా మీకున్న సందేహాలను మీరు క్లియర్ చేసుకోవచ్చు. ఈ క్వశ్చన్స్ అడగవచ్చు. And after this program, after that is available, our speaker is available. We can discuss personally also. Now, I invite Dr. Rita Kumari to express one of that.
Everyone. On behalf of the Department of Zoology, it's an honor and privilege for me to extend my gratitude and sincere thanks to our esteemed speaker of today, Dr. Karuna Kumari Madam, for delivering such an insightful and informative lecture on the prevalence and prevention of menstrual cycle disorders in women. Madam, your lecture was not only enlightened us but also raised awareness about the menstrual cycle and its related disorders that women experience today. So the various menstrual disorders that you have explained, like cramps, dysmenorrhea, PCOD, as well as the symptoms, causes, risk factors, and the diagnostic methods has really deepened our understanding of the prevalence of these conditions in different age groups of the women. Thank you, ma'am. Further, your emphasis on the preventive measures like maintenance of lifestyle, balanced nutrition, regular exercise, stress management, and on-time medical consultation has provided us with valuable guidance on how to manage and reduce the impact of these disorders related with the menstrual cycle. Madam, the knowledge that you shared today will undoubtedly help many of us over here to take proactive steps and make decisions to manage their menstrual health effectively, as it is very crucial for women's health and well-being. Thank you very much, madam. I once again thank you, madam, for spending your valuable time and sharing your knowledge. So we hope for such kind of lectures in the near future. Okay. I would also like to thank our dean and director, academic Professor Pushpa Chakramani madam, for her inspiring support and encouragement in conducting today's awareness program. Thank you, madam. I would also like to thank the teaching as well as the non-teaching staff and my dear students. Special thanks to the computer department for their support and cooperation. I once again thank one and all for their active participation, especially the students, for their patient hearing and in making today's awareness program a grand success. Thank you.
మంచిగా ఉన్నాను 9 మెంబర్స్